Hi, my name is Taylor Laughlin. I'm going to be placing in a G-tube. I have checked my doctor's orders, explained the procedure to the patient, checked them by 2 identifiers, and the bed is at a working height of $5. Alright, first thing I'm going to do is measure my tubing. I'm going to measure from the patient's nose to the earlobe, and the earlobe to the xiphoid process. At this point, I'm going to place a piece of tape to mark on how far we are going to insert the tube. I have my assistant ready with the water bottle. Alright, at this point, we are going to lube it, have the patient hyperextend. We're going to insert it, and when we feel resistance or the patient starts to gag, we're going to turn it, have the patient tilt their head down, and encourage them to take drinks and swallow. With each swallow, we're going to further the tube in 2 to 4 inches until we meet the spot of our tape. We're going to hold it in place. Alright, and at this point we are going to check to make sure it is in place, first by bringing out stomach acid. Alright, we've got some, and we're going to disconnect it and test it on the pH tape. Alright, and it should be anywhere from 2 to 5 on the pH scale. We're going to re-enter this. Okay, at this point we're going to wipe it off. We're going to draw up 10 to 30 cc's of air. And we're going to listen for gurgling sounds as we place the air into the tube. Alright, and once we know that the tube is in place, I'm going to wipe the patient's nose off just to make sure that our tape sticks well. As it dries, we are going to tape it to the nose and around the tube. Alright, and we are going to tape the tube then to the patient's gown. We're going to lower the bed. At this point, we're going to either clamp the tube off or apply it to suction or a feeding tube. We are going to document that it was placed, how the patient tolerated it, and how the 2 ways that we checked to make sure it was placed. Take off my gloves and wash my hands.